Welcome to Pathways to Fertility, a YouTube station dedicated to the women on the journey to conceive, especially the women who are on the journey to improve their egg quality, their overall well-being, to conceive the baby of their dreams. I'm Samantha Jacobs. I'm a licensed acupuncturist in Connecticut and New York. And I have been specializing in fertility since graduating in 2003. Today I'm going to be talking about an article that recently came out in Fertility and Sterility, one of my favorite research journals. And they are full of just tons of information. This particular article is focusing in on women who experience recurrent pregnancy loss. For me, this article stood out immediately. Recurrent pregnancy loss is a facet of what I treat in my practice. I am often having women come to me who are experiencing recurrent pregnancy loss. I can tell you currently I've had a group of women come into my practice who have had embryos genetically tested and been unable to either maintain a pregnancy or become pregnant with those embryos. They are often frustrated with the lack of solution from Western medicine, a lack of being able to, I'm going to say, think out of the box. That Western medicine has this tendency to say, well, we just don't know and we don't know what to do. And so I am often helping these types of women try to think through this process. Thus, this article stood out to me. If you just want the end result of this article, what this whole video is going to be about, basically, the research article indicates that women who have been diagnosed with recurrent pregnancy loss would benefit from genetic testing of their miscarriage tissue. And depending on the layers that are presenting, also move into IVF and complete a cycle of IVF to genetically test their embryos. That the two components often give the best result. Oh, and I'm going to add in there that the workup on a woman dealing with recurrent pregnancy loss is also the blood work to make sure there's no clotting disorders or autoimmune disorders. So the layer of testing can try to eliminate the genetic component. And as I read through this article, I came to a conclusion that obviously these authors are very much leaning into that more than likely genetic issues, chromosomal issues with the embryo are the primary cause of these recurrent pregnancy losses. And that genetic testing of embryos is one of the best solutions. So we're going to go through it because there are nuggets of gold in this article. And first of all, let's define what is recurrent pregnancy loss. And in this particular article, the authors have indicated that recurrent pregnancy loss is at least 2 miscarriages before 20 weeks of gestation. So with that definition, we can now move into what is the layers that are going on here. Currently, up to 50% of RPL cases are considered unexplained. So there's no definite diagnosis. There's not a reason for these recurrent pregnancy losses. To understand the layers of women in this pool of 50%, they plucked apart the research, and what they found was that there was a likelihood that a certain percentage of these women would go on to give a live birth, a spontaneous pregnancy going to live birth. But that was dependent upon maternal age and the numbers of prior miscarriages. Next, they looked at the idea that women with unexplained RPL have a higher rate of aneuploidy. So we're going to pause here. Aneuploidy is a term used for an embryo with chromosomal issues, genetic issues. And I am surmising that they are comparing unexplained RPL cases to the percentage of normal healthy women who might have a miscarriage. Interestingly enough, they're saying no, these women with RPL unexplained, they don't have a higher rate of chromosomal issues. Next, we have a comparison in live birth rates with women who have unexplained RPL compared to those with no RPL. And they are a big yes. Eutroploid is a term we use for a chromosomal healthy embryo. And though they don't indicate in the sentence, I am surmising that these eutroploid blastocysts are coming from IVF and have been genetically tested. Thus, we know it's a eutroploid blastocyst. So women with unexplained RPL have good birth rates with genetically healthy embryos. I thought this was a true nugget of gold because women who come to me in my practice to treat their frequent miscarriages often shoulder or hold the, I'm going to call it the burden, it might be a little too dramatic, of wondering what's wrong with their uterus. Interestingly enough, this research article indicates that whether the endometrium is less selective in unexplained RPL, it's a no. It is not, it's not a forefront running issue in RPL. I share with you ladies, you may want to work on, from a Chinese perspective, on your uterine lining and improve certain aspects of that, but not to shoulder the responsibility that the endometrium, your endometrium, is the cause of all of this. We have PGT-A testing, and I'm going to pause here and tell you PGT-A testing is the genetic testing that is done on embryos that are created with IVF. And the PGT testing looks for abnormal and normal embryos. So if the testing comes back positive, that would mean the embryo is aneuploidy, which that means it has genetic issues. If PGT-A comes back negative, that means the embryo is eutroploid, chromosomally healthy. And so they looked at, does PGT-A testing increase live birth rates or reduce pregnancy loss until delivery? And that is pretty much a yes for both. So we're starting to see there is a component in all of this that is related to the genetic quality of the embryo. Products of conception, POC, and that is the tissue that is released with a miscarriage. There are different levels of genetic testing that can be completed on miscarriage tissue. And the first basic layer of that genetic testing is called POC. The next layer, which is just a little bit more sensitive, is this 23 chromosome microarray test, CMA, it has the ability to test a variety of tissue that exists in the sample and rule out maternal DNA contamination, reduces false negatives. So we're seeing that here POC is the first layer of genetic testing. The next layer would be CMA. And then they briefly mention next generation sequencing. And when I researched it, because I wasn't even familiar with it, it appears that next generation sequencing has the capacity to look at a lot of diversity in DNA. With these 3 steps, the authors are indicating, these 3 layers of testing, that they are getting improved results in the clarity around the genetic issues that might be causing these miscarriages. This is the part I thought was interesting. By taking the steps, these 3 genetic tests on miscarriage tissue, and figuring out if the miscarriage was related to eutroploid, that would be a genetically healthy embryo, versus aneuploidy, which would be a chromosomal genetic issue with the embryo, combined with a standard RPL workup that women will get after a certain amount of miscarriages. Right? That's including clotting disorders and autoimmune disorders, looking at the physicality of the uterus, ruling out all those elements. That 90% of the 50% that are mentioned up here, these 50% that can't be explained, right? 90% of them can be explained. And that would help women and doctors figure out how to take the next step in the treatment process, be able to support the couple, the woman, to figure out if IVF is the solution, genetic testing of embryos is the solution, layering the treatment process so that couples can have the best outcome. They mention here some different subsets of women who are dealing with RPL. And I just want to go through them because I think when you're dealing with RPL, this might be able to help you figure out if you want to, talk with your doctor, redirect things. So let's go through it, even though it's a smudge dry. The first group is 41%. They will have a normal RPL evaluation, and their POC, products of conception tissue, tested, and it will come back positive for aneuploidy. So 41% of these women will want to go through some kind of 6 months of suggested management and then move into IVF with PGT testing. They mention here that women who have maternal age, or they even wish, it's like, okay, let's just move into IVF, that these women get the best results by having the PGT testing and having a transfer of a eutroploid embryo. We have 3% of couples with RPL where they've done the genetic testing of miscarriage tissue. It's come back aneuploidy, and it's indicated that there's a layer of genetic issues between the two of them that probably consistently create embryos with, chromosomal issues. And it's mentioned here that they should go through genetic counseling and, is this genetic issue something that can be helped or assisted with, or is it best to just move into IVF with PGT testing? 34% of RPL cases will come back eutroploid result on the genetic testing of the miscarriage tissue, but the woman will have a abnormal finding on her RPL workup. And this is an indication that the woman should receive treatment for approximately 6 months. And in this case, because there is not a genetic issue related to the pregnancy loss, she doesn't need PGT. Obviously, I think they mention here, that advanced maternal age, decreased ovarian reserve, or male factor would qualify that woman to move into the next step of PGT testing, IVF cycle. So if you're one of these women falling into this category, 6 months of natural conception is an opportunity for you. 14% of couples with RPL will have an aneuploidy genetic result of the miscarriage tissue and an abnormal finding on the RPL evaluation. And in this case, there's 6 months of treatment followed by the couple moving into IVF for PGT testing of their embryos. This is another nugget of gold in this article. They're talking about the 8% that are truly unexplained. So their genetic testing of miscarriage tissue indicates that they're eutroploid pregnancies and they have a negative RPL workup. The author mentions here that maybe they should go into experimental therapies to try to address the problem. I would say that these are the women who find their way to my practice. If it wasn't for Chinese medicine, I think I would be baffled because it doesn't make any sense, and it's an element of how do you help yourself if there's no indications of what steps you should take. When I have the lens of Chinese medicine to look and help these women, it opens up a whole new world. And it gives us an opportunity to refocus, support, and help this woman to be the best she can be to move into a potential next pregnancy. Say it again, they're mentioning it here again, that the genetic testing of miscarriage tissue is important, and also the layer of IVF with PGT testing has the possibility of giving women, couples with RPL, an opportunity for a live birth. The authors are proposing for Western medicine to reevaluate how they look at different layers of this issue. And first of all, they're indicating that the clarification around the definition of pregnancy, that a positive pregnancy test should be enough to indicate that that woman was pregnant. Once again, this is something I see in my practice quite a bit. Women get pregnant, they pee on a stick, and then 5, 10, 15 days later, they have a miscarriage. And when they go to their OB or they go to the RE, for whatever reasons, Western medicine doesn't see it as holding as much value as if they had came in and done blood work with an ultrasound. That the idea of a chemical pregnancy, it doesn't have any weight to what a woman is experiencing. I think it would be incredibly helpful to have a positive pregnancy test be a mile marker for women so that they can get appropriate support. They recommend the inclusion of these layering of genetic testing on miscarriage tissue. Once again, I've experienced in my practice, women have miscarriages, and especially when it becomes reoccurrent, they want to have their miscarriage tissue tested. And I've seen a lot of resistance, a lot of brushing off of the woman, that this genetic testing of miscarriage tissue doesn't have the weight to address any problem that's going on. And, I mean, yay, let's add this layer in. Let's help women and couples figure this out. The last comment the authors make is in regards to including the opportunity for PGT testing of embryos in couples, women who are experiencing recurrent pregnancy loss. To me personally, PGT testing in this case, why are we not covering it as a medical expense? And there are a lot of couples who can't afford to step into PGT testing. It's very expensive, and insurance doesn't cover any of it. I was appreciative that this article brought up some very good, solid concerns for couples who are dealing with RPL. And I'm going to make a second video because I'd like to talk a little bit about what I see in my practice when women come in and how Chinese medicine approaches it, so you can see a different viewpoint. I personally find when I talk to some of my patients that they feel brushed off, that everything just falls into it's got to be a genetic problem. Well, I am interested, ladies. Fill me in. Have you want to share anything? Do you have any comments? I would love to hear your feedback. And like I said, I'll come back for another video on recurrent pregnancy loss. If you like this video, please hit like, please, please, please. And if you would like, you could be my second YouTube subscriber. I say with tongue in cheek, please subscribe. And I look forward to seeing you, speaking with you next time. Bye.